Welcome everybody, my name is Tim from Signage Live, and with me today we have Josh Petro, Unified Communications Architect at University Hospitals in Cleveland. Well, Josh, thank you very much for joining.
Sure, thanks Tim.
Now, obviously, what we wanted to do today is just get a little bit of an understanding of what you're doing with the digital signage, how it's working with Signage Live. We've got some questions here we want to take you through. But before we do, would you mind kind of just giving a quick introduction of yourself and what your main role in the company is and what you tend to spend your time doing?
Sure. Yeah, so I'm the Unified Communications Architect, and so I handle the voice, video, and communications design for the health system. And so that includes any new conferencing platforms that we have, like I mentioned, voice or video, and testing out any sort of new hardware in that realm, as well as working through the workflows with our clinicians to make sure that they're communicating as effectively as they can.
How long have you been in that kind of role?
I've been there for 13 years and in the role for probably about 10.
Very tenured, fully understanding all of the solutions, all the outfits that you've got going on today. That's kind of why I wanted to have you on the call today, because I think understanding where your experience takes you with these questions and what the leading questions are for you is going to be really insightful for some of the people looking into digital signage now and what they're looking to understand. So I appreciate taking some time today. We're going to go through those lists now and just we'll kind of riff off of that as we carry on through these questions here. Could you give me a bit of an overview on University Hospitals of Cleveland specifically, more kind of what's it focused on, who's it serving?
Yeah, so we're a regional health system. We're actually founded back in the 1800s, 1886, I believe. And we have 21 different hospitals, including 5 joint ventures that we have in the area. And there's around 50 health centers that we have in outpatient facilities and about 200 physician offices in 16 different counties in Northeast Ohio.
So are you managing all of those, or is that separated between individuals?
Yeah, with the exception of the joint ventures, that falls under my team for everything Unified Communications.
Wow, that's a lot of locations and a lot of people.
Yes, it is.
So with your day-to-day kind of involvement, as you mentioned there is a team, what does that kind of team comprise of? What are the responsibilities that help you deliver that communication?
Sure. So we have engineers, everything from entry-level engineers that are handling kind of the day-to-day stuff to senior-level engineers that are handling some of the upgrades, some of the more difficult tasks from the configuration standpoint. That requires some more training. And then we have our analysts that are handling even more of the day-to-day stuff of, just simple things with the phone system, all the way up to, call recording and digital signage.
So going on to digital signage then, how did that kind of turn up on the horizon? Was there a particular ask from someone? Was it something that you knew you needed? Where did it come from originally?
Yeah, it sort of happened organically and things just kind of evolved from there. Somebody said they wanted to have a digital sign. They realized that, the cork board that they used to have up there where they would just stick on a piece of paper was kind of falling short. And so it just kind of happened organically.
Mm. And was there, when that kind of question comes up, is that taken straight to you? Does that go through like an approval process? What generally happens in that case?
Yeah, now that I'm known as the digital signage guy, we have the requests kind of fall through me. And then, at this point, I'm kind of an army of one. We do have our support staff, but we just haven't gotten to the maturity level of where I'm comfortable to kind of push it out there. The team's trained for the most part. They have an understanding of how the system worked, but we're still kind of, keeping things a little closer to the vest just to make sure that it's rolled out properly. And then once we're rolled out, just adding more is just going to be kind of, copy paste type stuff.
Sure. And how many devices are you currently managing?
It looks like we have 80 devices in Signage Live, and we have another 40 or 50 or so that are out there that are just either not on Signage Live or not on any system.
Sure. So just ones that have kind of been left in the ether. And is there a plan then to kind of compound those, or are there specific reasons for that being separated?
Yeah, some of it is cost. Some of it is just they don't need some of the things that, Signage Live offers. The content never updates. So some of it's behind glass. Sure. And it just sits there. No. So, yeah. So other than a security perspective of making sure that the BrightSigns are up to date, we really don't touch some of those devices.
That's actually was going to be my next question, just around hardware. So these are all BrightSign devices, if I'm not mistaken, right? And there's potential conversations about looking at ClickShare devices in the future as well?
Yes. So with the newer ClickShare devices that are more powerful than they used to be, just with the technology getting more and more powerful every day, We are looking at putting some signage live into our conference rooms as well.
So going back to that driving question, so I mean, I think the numbers you're talking about, you're definitely talking about encroaching on a more enterprise solution. Like you've got a lot of variable pieces, a lot of different locations. It's not something that you can just kind of set up in a day. It's part of that managed communications as you were talking about. Was there a driving communication that actually needed to be sent out? Is it picking up, informing people what's going on from an end user perspective? Was it more about engaging with the workforce? What was the driving content tool, I guess?
Yeah, I think some of it was we had seen it done poorly. And so we wanted to have no part of that, right? So we wanted to make sure that any signage that we put in, it was the exact opposite of what we had seen, which was, stale content, poorly designed, didn't match. So that was really what we were trying to go for.
So I 100% agree with you. Content it doesn't matter how shiny the screen is, how big the screen is, how good the CMS is. If the content's rubbish, you might as well not do it. It all comes down to content at the end of the day. I don't think we discussed this on our kind of preamble call, but was this going out to, is there a workforce element in this, in talking to employees, or is there a bit of a split role? What's that kind of segmentation look like?
Yeah, so, being a hospital, a health system, reaching the clinicians is difficult. So they're often, 90% of their day is taking care of patients, and they're all busy.
Sure.
So they're not sitting and looking at email like you and I are every day. And so they miss some of those communications. And it could be everything from, your healthcare enrollment is coming due to, somebody has an event that's happening that, you may want to go to. So, and then there's other things that are more important, I think, like, some of the feel-good stories of, hey, this is what happened with the patient. This is what this person did. And wow, look at the outcome. So just kind of those stories that maybe are told at the water cooler, so to speak, and don't get advertised as much. And so with the signage, we're able to put that out there for everybody on the floor to see. And it's something that's, if you plan it right and you design it right, they're able to see that quickly and able to digest the material wherever they happen to be.
Sure. No, 100%. It's funny you mentioned that water cooler, specifically that sentence, because I used it for the first day today. I was like, it kind of does replace some of that in the busier areas where you can't sit down and have a chat with your colleagues and your peers and understand what's going on. It's just another way of slowly injecting that content and information across an entire day or a week or a month, because we're as humans, we're kind of almost always at capacity. So we need that continuous reminder. An email can get vanished, a notification on whatever messaging service eventually vanishes. But to have a tool that's, just a periodical drip feed reminder is really, really useful. Thank you for that. I appreciate that answer. That's really insightful. Has there been any general feedback on the digital signage since that takeover? Has there been any, from executive level or even just the employees kind of registering that this change has happened? Well, I'll be keen to understand what the feedback's been like.
So we do have QR codes that we're able to track. So if we put something up there at a minimum, we can see, there's been X number of clicks. And so we can tell, how relevant that is then to the patients, to the caregivers. And so the other thing is that we don't hear a lot about it, which I think is positive in that if it's bad and it's been poorly done and implemented, then, people complain about it. Hey, you have something in here for September and it's July. So I think that no news is good news, so to speak. But with the advent of QR codes, we'd have been able to track it and have really meaningful data to go back to leadership and say, hey, this signage that you invested in, look at what it's doing. We now know that these many people have clicked on, so to speak, this information.
That's really interesting. Yeah, we talk a lot internally about return on investment and how do you measure that in digital signage, because it's slightly less tangible than, well, I guess a hospital scenario is slightly different, but if you're working in retail or something, X amount of purchases is increased. But in this case, it is the intangibles of how effective was the communication. That QR code is a really good idea. I'll probably be stealing that, to be honest with you, as an ideas and suggestions. How long have you been running that QR code service for?
Since our marketing department took over the content management, they've really started that right from the beginning. So we've probably had that running for about a year now. Okay,
so it's had some time to settle in, and has helped you kind of deliver some of those return on investments to boards or whoever that might need to go to?
Yeah, really the leadership, just because they were kind of hesitant, I think, because, there is a cost to install electrical where it may not, be, and data and that sort of thing. And so, you know, to have them make that leap of faith without knowing, and then now we're able to back it up, we can show them that it was a good investment.
Fantastic. That's good news. So it was the outcome that it was considered a good investment? I guess I'm putting my life on the line with that, but yeah. Okay, good.
They do
Okay.
ask to put stuff on the digital signage, and I think it's still a little bit of a nebulous concept to them, or it's a little bit of a mystery of how that happens, but they at least understand it's there and they see it, and now they're asking, hey, can we put this out there?
Yeah, we typically do always get these conversations where it starts off going, well, we started off because we needed to communicate X, Y, and Z. But the second you put those screens up there, people start to go, oh, could I use this for X, Y, Z communication? Could I expand it upon, I need to get this communication out. Have you felt like that's been the same, where channels have started to grow out as needed?
Yeah, absolutely. I think that, some of it is just they don't know what they don't know. And then it's, again, if we have a standard set up, then now they know, okay, if we want to put signage out, this is how we do it.
Yeah,
and it has evolved from that to now we have doctor directories. So when you go to your physician's office, it has the whole directory listing of who's where in what building, or potentially, what floor, room, and that sort of thing. And so that's a huge cost savings for us, because now we don't have to go back and change a suite number or who's in the building. And so there's immediate ROI with that versus static signs.
Yeah, 100%. I think I was speaking to someone yesterday. We went down to speak to another customer. They said they were saving about 3 hours a day for an individual of just walking. This is a huge campus, but to just quantify, you can quite easily reverse engineer the maths of that and just go, we've already got quite a cost saving there before we even start talking about the deliverables. Just the time saving there is incredibly powerful. So that's really good to hear. But when we were talking, I believe you were looking at, you have 2 individuals that are now kind of responsible for managing the content, right, from the marketing team?
Yes.
Do you feel like that's that to me seems like quite a success in terms of 80 players, 2 members of staff that are kind of responsible for that content generation. Do you feel like you're at capacity, or does that just feel like the right amount for you?
No, I think it's perfect in that they're trying to get out, one message if they can a day. And so that's generally what they're doing now for the general population, for those who are able to read their emails. And so, it's kind of, they're just copying and pasting that information, or maybe changing it around a little bit so that it fits, in a digital signage platform versus an email. But they're still just taking that content that they're giving to the masses, and they're just massaging it so that it fits. And it doesn't seem like it's a heavy lift for them at all. And they're both really passionate about it, and they want to make sure that the caregivers know what's going on. So it's been a fantastic fit for us.
That's great. That's great. With the research that you're doing for digital signage in the first place, what was the catalyst? What was the thing that made you start to look at saying we need to look at a CMS platform that allows us to deliver content in this way?
Yeah, our CIO's message is everything in IT needs to be simple, intuitive, and mobile. And so trying to find a platform that checks all those boxes was really the impetus to try and get this Signagelive installed. We had already had a signage system in here, and that was just kind of implemented for our cafeterias. And it works really well for that, but it doesn't really expand well. And so trying to fit that into the square peg into a round hole type of thing was just not flying for us. So that's when we started reaching out and trying to figure out what else could we look at to potentially fit that mold.
Awesome. Was there a list of must-haves, things that you had to that it had to achieve? Was there any kind of feature sets or specific pieces of that deliverable that you needed to build around?
Yeah, I think from an IT perspective, it needed to be able to have single pane of glass where we could look at all aspects of both the players and the content and management of the content. That allows us to put things out there effectively and manage them effectively. And then again, from the user standpoint, and our 2 marketing gurus who are fantastic, it just needed to be something that they could jump into and not have to learn over and over again and fight the system or look at how-to documents. It had to be that simple, intuitive, and mobile. Sure, that's what guided us to you guys.
Perfect. I appreciate that. It's really insightful. So just kind of coming to a close as we go through this, but how do you feel like this has impacted communications and your role, I guess, because obviously you've been responsible for the fact finding of it and actually implementing it. There is a team obviously helping deliver the content, but on your day-to-day experience, what's the impact been?
Yeah, I think it's great to have another communications outlet or tool for us to get information to the caregivers. It increases awareness on everything from our just general news of what's going on in the health system to the different initiatives. And then again, with the QR codes, we can have tangible feedback from them to say, this fits and this works for us. Because again, they're all head down and trying to help patients and don't have time to check communications as frequently as others. So, all those couple of points, I think, again, just make it very effective for us. And I think it does have a significant impact because people don't miss, dates for signups. And, with COVID, hopefully being, waning at this point, there's always information that needs to get out there. And this has been a really good way of getting information to our people.
Sure. Great. Are there any future plans that you have in mind, or are we kind of just at the point where we've got everything covered?
Yeah, there are. So I think, what we'll be doing is taking more of a data approach with some of the information that we have, and the QR codes are a huge factor in that. We'll be showcasing more of the, feel good information, and probably just as much, maybe a little less of the need to know, quote unquote information. So those are a couple of things. And then some best practices. We're going to try and investigate that a little bit more with the QR codes, just to make sure we're doing it right, that there's not other ways to do it. And then probably an expansion to more of our patient-facing areas, just to kind of see if, we can advertise a little bit more towards different services that we have, or potentially some wayfinding help, that sort of thing.
Okay. Actually, you mentioned something there that I'd love to dig into a little bit more if I can. You mentioned that we're going to take it away from more of those kind of the processes you have to put in place and actually focusing more on feel-good stories. What's the reasoning behind that? Because I'm hearing similar things, and I'm kind of interested to see what the trend is that's building out there.
Yeah, I think in general, just you go to work and you're making the donuts, so to speak.
I actually know that reference. I saw that video the other day.
We go to work, I think, and we forget sometimes why we're there.
Sure.
And I think the clinicians, the healthcare industry around the world, are underappreciated a lot of times. You just kind of, if you end up in the hospital and they're taking care of you, everything from a hotel type stay to, the advanced medical care that you're getting. So there's a lot more that goes into it than just showing up for work every week. And so we want to make sure that our healthcare teams understand that they're appreciated and the impact that they have on their patients' lives, just because it is profound.
100%.
You're touching a person when they're at their worst time of their life, potentially. So we want to make sure that those stories get out there, and that the employees understand that, we're all a team together, from everywhere from IT to environmental services, to the C-level folks that are leading the organization.
That's actually, I couldn't agree with you more. I spent a period of my time when I was working with long-term care with risers and recliners and delivering them to people who are kind of staying at home but having the care taken to them. I totally get it. I think it's you can't support that team enough with feel-good stories and kind of outcomes of the actions that they're doing to really deliver that value. And I think it's quite a refreshing way of looking at it, because we can very easily get dragged down into just the data, just the numbers. Can we get the ROI based on this? But sometimes it is just about it's fueling the creativity, or fueling the interest and the passion to carry on doing what they're doing. So that's really, really fascinating. Thank you. That's really all the questions that I had. Is there any kind of final thoughts or comments that you had that you wanted to add in here before we wrap up on this call?
Yeah, I think just from an IT perspective, if anybody's curious or that's watching of, how to do this, you just really need to do your research. And I think make sure that you understand what the capabilities are of the companies that you're talking with. Not all the signage vendors are created equal, and we definitely found that out. And so make sure it's going to fit your needs before you pick it. And then, do as many proof of concepts or, as much investigation as you can, just so that you're sure that you're going to fit the needs of your organization, and make sure that the business is driving the decision and not IT. From an IT perspective, I can always get caught up in that. But the business at the end of the day is what we're doing. It's not IT. So let them lead.
Yeah, you made an amazing point there. Do as many proofs as you want. I think if you're dealing with a company, whether that be the reseller partner or whoever is actually going to be delivering the hardware, etc., you should find a partner that can allow you to go and experiment for the first 1 or 2 devices, because especially if you're expanding to the size that you guys are at now with 80, leading into 150 odd devices, you make one simple error on that first device and you really mess up, the whole infrastructure. And obviously that's kind of your main responsibility. And it seems to have done your due diligence. It's paid off dividends, and you're at a point now where it is showing value to the company.
Yep, absolutely.
Cool. Josh, I really appreciate your time. Again, thank you very much. And if you've got anything else, you're more than welcome to come back on and we'll do another deep dive, because it's been really genuinely fascinating talking to you.
Thank you, Tim.
Cool. Thank you.